Do you or someone you love struggle with ADD or ADHD? Is it a superpower or a setback? Today, we're diving deep into the brain with renowned functional neurologist Dr. Michael Bagnell to demystify the truth behind attention and impulse control. Discover game-changing medication-free solutions, powerful brain health strategies, and daily hacks to transform chaos into calm. It's your time to unlock the brain's fullest potential right here, right now on the Crackin Backs Podcast. Dr. Michael Bagnell, functional neurologist. I am so happy to have you on. You're one of my closest, dearest friends in the whole wide world. Good to have you, buddy.
Great to be here again. Love being with you guys.
Always chock full of information. Go ahead, Terry. What were you going to say?
I think he's like the first one we've had on 3 times, and it's like every time it's like we need so you set a record, and it's like every time we're like, okay, we need him again. So congratulations on being number 1 on that.
I need a T-shirt.
Yes, you do.
That's three times the charm.
3-peat.
There you go. That's even better.
He's our brain consultant. So
totally.
Let me, Mike. I gotta commend you on the title of this talk today. Is The Wheel of Misfortune. You came up with that. Is as brilliant can be, and it's where mental health meets neuroscience. And I love this conversation.
Yeah.
Thanks for coming up with that. But I think we need to take that lecture on the road. So anyway,
for sure. Yeah. I mean, that's kind of the tail end of what we had last time. And then we're also talking about, we needed to talk more about ADHD as well. So I mean, these things kind of overlap. I think you would agree, right? If we did, what do they call them? Venn diagrams.
Yeah.
We have anxiety, depression, and attention. And those things can all interact from some of the same brain areas and create different kinds of cascades of problems for people, as we know.
I'm so excited about this conversation.
Yeah, because America is afflicted with these conditions, especially the ADHD and Adderall conversation. So, Mike, could you start talking about some of the underlying neurological imbalances that contribute to that whole mental health disorder, like anxiety, depression, ADHD, to just kind of launch off of that?
Yeah, I mean, let's talk about what has been the thought for previously to this point has been chemistry. It's a chemical imbalance, whether it's anxiety, whether it's depression, whether it's memory, whether it's attention. And it being a chemistry problem, or at least treated as a chemistry problem, it's usually with pharmaceuticals that, that will increase or decrease, suppress things in the brain, as we know. And what we've come to realize is that it's not always a chemical imbalance. In fact, it's very hard to measure a chemical imbalance. And Dr. Daniel Amen, I'll refer to him, who's one of the more well-known psychiatrists in the world, who has said, why have we, not us, but he as a psychiatry profession, why have we not used technology, imaging, to understand the organ that we're treating? And we base it mostly on symptoms. You say, well, symptoms are a pretty good indicator. And I would say, I agree. And I would say it's an indicator. But now with imaging, meaning brain maps, or eye tracking studies, or cognitive task tests, outcome assessments, we're able to dive a little bit deeper under the hood, if you will, using the car as a metaphor, right? Under the hood of someone's brain, dealing with attention or depression issues or anxiety or even OCD and bipolar, any of this strata, and say what's underneath in the networks, like you're talking about, in the brain hardware, that might actually be the problem, besides the default switch, which is it's a chemical imbalance. And so that's kind of where we are today, definitely in functional neurology. And to some degree, psychiatry might be moving that way too, although there's still a strong reliance, of course, as you know, on chemistry, I think because people are needing immediate relief. But there's so much still questionable as to how do SSRIs, how do SNRIs, how do these medications really work? Even Dr. Andrew Huberman has explained much of that on his podcast and his YouTube channel about that we are not certain. This is what we believe to be how these drugs work. So we're looking for a different way, looking for an alternative way to help people with mood issues, attention issues, cognitive decline. And we'll talk today about is that really possible? And I think to give the short answer, it is possible. It is possible.
To build a foundation, can you elaborate on the importance of dopamine and serotonin, where it comes from? Because I know it was isolated back in the late 1800s, and that was great. But then somebody decided to, how could we enhance dopamine production in people? And that's then the onslaught or history of amphetamines, and cocaine was actually legal at one point. But go ahead and elaborate on that.
So dopamine is created so these chemicals are created in our brain stem, in our brain tissues, and they're created when we fire one neuron to another. What's released in the cleft, if you will, the space, is brain chemistry, neurotransmitters, neuromodulators. So dopamine is produced primarily in the upper part of the brain stem, where actually we would say our fight or flight response emanates from. Our survival response emanates from that upper brainstem where dopamine is produced, which gives us, right, our drive, our outgoing activity, our ability to pursue. Think about dopamine as like, I'm going after something. So of course we need it. It's for movement, it's for thought, it's for brain function. Then you come down a little lower and you have serotonin production, which makes you more satisfied, helps you to sleep better. You feel more calm, less pain. And so it has many effects through the brain. But this dopamine serotonin kind of marriage, if you will, is really what's driving our pursuit behavior for living and our satisfaction with what we have achieved. And so they're made in the brainstem because neurons are firing. And then we have the flip side. If they're not firing so well, maybe we're not making enough of that chemistry, which then leads into many times a disorder that is because of the chemistry lack or too much, but is driven by a improper firing patterns in the brainstem, possibly.
Let's talk neuroplasticity, neuronetworking, the way it plays into mental health, and how does functional neurology and the techniques that you do, which I would love for you to elaborate on some of the, instead of prescribing a medication, I often describe what you do as giving exercise to the brain, but first we got to find out what muscles are weak.
Yes.
So like Dr. Terry and I, that's what we do with the from the neck down, whereas you identify the weaknesses or where there's too much strength in the neck and above. So
yeah, that's a perfect example and metaphor for going into this. Is like, let's step back for a minute and say, okay, let's understand, and I'll say it this way, the hardware. What's going on in the hardware? We can maybe think of it like the software is what your thoughts are, what your mind is, what emotions and mood you have. That might be considered more the software side, the expression of what's going on in the hardware. But the hardware is what we're going to look at. And we're going to attempt to understand, is the hardware in some kind of dysregulated state? Is the hardware damaged? Maybe someone has played sports. Maybe they have some sport-related head impacts. That maybe they didn't suffer a lot, but there was a head impact. Or maybe they had immune changes that were pretty strong at different points of their life. Strep as a kid, who didn't have COVID during that time, and different things that might have affected immunologically that brain and brain tissue. So in the analysis of the brain, there are certain signatures that we can look for when someone has a mood disorder, say depression or anxiety. I'll just use those two, that we can look for a signature in some of the biomarkers that would give us an insight into, oh, that's where that might be emanating from, that piece of hardware, just like you would in a computer when you have a computer problem.
I love it. Some of the things that you do, though, are highly fascinating as far as retraining the brain through visual or eye movement patterns, or hand, modulating hand movements and balance. What are some of the things that you would do for some? It may not necessarily be the same, but what would you do for something for ADHD that maybe had been taking Adderall or off Adderall or was suggested Adderall?
So much of the time we'll say, and it's primarily young people, although we have some adults with ADHD. When we're thinking about that, we see an over-arousal pattern, too much activity in that upper brain stem. an over-arousal pattern. So what we want to do is, and I think you mentioned earlier, is we want to figure out how do we help to lower the over-arousal pattern in this person. The medication is actually increased. So it's an over-arousal pattern from an area that produces dopamine. But we're going to give them something which actually helps them focus to a degree, makes them usually not feel so good in other areas, as many people report, but it increases their dopamine. So typically, even when they're on something like Adderall, Vyvanse, and so on, we're seeing an even higher arousal pattern. So that might help me produce, right? If I have to have a 12, 14-hour day, if I'm an adult and I'm really driving in my business, or a kid, but you're probably not going to feel so good being like that for weeks and months and years on end. It's really, in a way, you could think about it like being in overdrive in your car. So an evaluation of someone's brain with brain mapping and eye tracking, cognitive testing, autonomic testing also gives us ideas and gives us data about what's going on in areas of the brain so that we can then say, does this fit with what they're presenting with? Is it some mood issue or is it an attention issue or both? And then how can we strategize therapies? Well, you say, well, what kind of things would you do for that? We use the sensory inputs to modulate the brain. Very simple. What does that mean? Sensory inputs, the eyes, the hearing, and the vestibular system when you're moving your head, your vestibular apparatus, and your body, which is what you all work on, right? The somatosensory, you can say the proprioceptive. We use those three major inputs to drive activity into the brain in the direction or to the region that we want to increase or inhibit activation. That's very simply put. Does that make sense?
Yes.
Yeah. And so when people say, well, how do you do this? I say 3 sensory inputs. We drive activity into what we're seeing here on your brain map, into this area where it's not working, into this area where it needs to be inhibited to bring about a change. Let me tell you what happened yesterday. This is I was even astonished, I'll say. So we have a woman who's in her early 50s, was a critical care nurse for many years of the floor. So she was the floor supervisor, and she had a concussion. She was training for yoga to be an instructor, and she fell a little over a year ago, hit the back of her head, has a concussion. She also has some immune issues going on. So she had kind of different layers because people aren't limited to one thing, right? She currently cannot walk. She's in a wheelchair. She's been in a wheelchair for about 6 months.
How old is she?
51, 52. So this is a very high performing person prior to this injury, right? She's not only a critical care nurse and a floor supervisor, she's doing a training class to be an instructor for yoga. I mean, she was a pretty sharp gal. So after this injury, she deals with this and she continues to progressively get worse and worse and worse. Things happen with her blood pressure, goes out of control. Things happen with her heart rate. She is definitely in a clinical depression state. She's been treated for depression as the primary thing. The reason you're like this is because you have depression. We've seen that so many times. And so we've been dealing with her on a dysautonomia basis, meaning her brain, because of the concussion, cannot regulate blood pressure, heart rate. So she stands up and her blood pressure goes through the floor. She's sitting down, her blood pressure is 110 over 80. She stands up and it goes to 90 over 60. And she says, I feel like I'm just draining. Everything's just draining out of me. So I can't stand up and walk. My legs have different symptoms as well. So now back to the sensory inputs. So we're using her vestibular system to improve her brainstem function, which also we talked earlier about. That's where your chemistry is made, right? And she is depressed. She has a very negative affect because of suffering for so long and being hopeless. So many doctors. I mean, if I tell you the list of doctors, you'd say, what? But you have experienced that already. People going to clinician or doctor after doctor and saying, no, it's in your head. No, you don't have that. Just keep working out. Just keep doing that. You'll be better. Change your diet, et cetera, et cetera. And those things are not inaccurate, lifestyle measures, right? But she has not had anyone look at the brain stem function in relation to the concussion. In fact, the immunologist said about a month ago, you didn't have a concussion. I said, wait a minute. You were training for the class. You fell backwards, hit your head on the floor from an upright position. A week later, the symptoms started and you don't have a concussion? I mean, we're just being logical here and rational and looking at the data that presents, right? And so yesterday, here's what happened. So she can't walk. And every time I ask her, she does have to get up out of the chair and sit in another chair for therapy. So she can get up, but she just can't walk across the room. And it becomes a very overwhelming experience because of the feeling and sensation and the blood pressure drop in her emotional state. Very fragile. So yesterday we do a vestibular therapy. We built her up to a level to do this more, let's say, immersive vestibular therapy, where I'm putting goggles on. Dr. Barron, you've seen the goggles we put on, so they can't see anything, but we can see their eyes. And I have her in a rotational chair, and I'm doing some therapy to work on her vestibular inputs. And I do the work with her that I've determined on previous exam. It has to be rotated in this particular direction at a certain speed. So we're giving her vestibular input. So we take the goggles off and I say, okay, we're going to move you over to this other chair now, which is across the room. And I'm looking at her and her husband standing behind her. She goes to get up out of the chair like that. Every single time, if I can characterize this, prior to that, for 3 months, we're at the end of her cycle of care. I ask her, we're going to get up and change chairs. Oh, here we go. Oh, all this emotionality and physicality comes out. When I said to get up, we're going to move, she just went to get up out of the chair and she said, oh my gosh, I feel like I'm back to myself. And then she started to cry. She said, I didn't even have a thought that something was wrong. It was so remarkable. Now, did she walk across the room? I helped her. But what I saw there, it was a very powerful example of how the accurate input to the brain through the vestibular sensory system, right? One of the sensory systems could alter someone in a moment. Sometimes it takes weeks or months, but sometimes in a moment, you can actually alter a functionality of the brain. Exactly like we've had someone, they're feeling something, we've adjusted them, they get up, they say, oh my gosh, it's completely movable and it's better, right? I don't feel any of that. You've had that experience dozens, if not hundreds of times. This was related to the brain. So I saw this was where we have to keep building and strengthening this woman for full recovery. So I'm very hopeful she'll be out of that wheelchair in the next 3 weeks.
That's awesome.
Whoa,
and that will affect her mood for sure.
Oh yeah, for sure.
100%, because she was happy. Like I didn't even think about my body when I just stood up. Prior to that, her mind is always, because something shifted radically. Isn't that? It was shocking to me. I was like, whoa, this is the right therapy for the right time with this patient.
That is just fascinating, because it's really, finding the key that unlocks the door. Meanwhile, you gave her hope. So that elevates the mood. You get a little dopamine response just from that alone.
Yes.
Thank you for sharing that.
Great stuff.
Let me go back to some confusion I even have in regards to when many years ago, I remember ADD, and then all of a sudden they changed the nomenclature to ADHD. So ADD was attention deficit, and then ADHD became attention deficit hyperactivity disorder. My personal feeling is that they changed the diagnosis to be more inclusive so they could put more people on Ritalin or Adderall. What are your thoughts about the differences between ADHD, ADD?
Well, there's different subtypes that fall into that category of attentional challenges, we'll say it that way. There's oppositional defiant, there's the inattentive type, there's the hyperactive type. Right? So there's different subtypes that medicine and the DSM have quantified, because that's the world that they look to work in, right? I guess you might say, much like we're saying subluxation in the cervical and subluxation of the left sacroiliac, and they say, what are you talking about? But here's the thing. We like to let families know, and they call us all the time. This is probably the highest level need that we get calls from more than anything else is ADHD. At least that's the diagnosis they come in with. And then we subtype it out based on an inventory that we have the parents do, which is a standardization that we have, and we have them fill it out. And I say, okay, they're not ADHD, they're ADD, based on this one outcome assessment that is a standardized evaluation called a Vanderbilt test. And we can see where they fall in that. What's the benefit to us? That's more for the parent. Because I don't treat ADHD or ADD or inattentive or ODD. I don't treat that. You say, well, I thought that's what you do. No, I treat the hardware that we believe is driving the imbalance. So that's not a play on words that I'm saying that. I'll let the families know. My goal is to improve that temporal lobe and that frontal lobe connection for your son so that his attentional problems diminish and he's able to perform better in school. I'm treating the frontotemporal issue that I found in this examination. Oh, so I'm not treating his attention deficit per se. It's not semantics, if that's what I'm saying. I'm not trying to play a game with them. I'm trying to show them what's really behind the diagnosis, because the diagnosis can be helpful for them in school things where they get certain distinctions for longer test taking time. But for us, it's less helpful because I'm not giving a medication based on that diagnosis. I'm providing therapy based on the hardware, the maps that I found, the understanding what's going on inside the brain. That's what I'm trying to improve. And so when I improve those mechanisms, typically the condition that they're dealing with, suffering with, attention in this case, and I'm going to call it three things: attention, focus, and concentration, kind of overlapping things. It's not all the same. Those things will improve when I improve that hardware. So diagnosis is less important, although that's why people come to us. And then I help them see a little bit more. I kind of open up a door to another room for them.
To use the car metaphor, I imagine when you're mentioning this is that you're driving on the expressway and at 75 miles an hour, your car starts to shake. Is the solution, don't go past 70 miles an hour or fix the problem, So
right.
That's the beauty of understanding.
But what happens if you go to 100? Does it even out?
Not usually, right? Not usually. The higher demands on the system often bring out, like the higher demands, like a stress test often bring out. So you'll have a young person that will have problems. And let's say they have a diagnosis externally. Let's say they've used medication. Maybe this is common. We use it during the school year. We're off in the summer. Okay. Then they become a teenager, higher stress, like Terry's saying, driving at 100 now. Now that ain't enough. Now they're often, not little amount of time, self-medicating, finding other things to help soothe their brain because they can't sleep at night and their brain is racing. And I'm trying to self-soothe. And that usually leads into bad places for teenagers, as we know, right? So whether you're dealing, and there's a lot of pharmaceuticals that are being sold among these teenagers now. So they're selling Adderall to each other. They're selling Xanax to each other. They're selling antidepressants to each other. And we see, and of course, opioids all the time we're seeing it. I had a college kid just come in a week ago dealing with migraines, bought some Adderall because it helps her migraine. So this has happened from a friend. So this is a big issue. So the more we can help people have other alternatives and fix brain function, the better our young people are going to be, right? And the longer they're going to be safe and healthier.
And by the way, Terry, if you're going 100 miles an hour, that you get a traffic citation. So that's just letting you know. Anyway.
Unless you're on a NASCAR track.
Or driving to Vegas.
ADD and ADHD are sometimes considered a superpower.
Yes, I agree.
Right? Allows you to really hyper-focus and be more innovative. And obviously that's why some of these people want to, take the Adderall that, continue the stimulation. But, when does thriving become a struggle?
Yeah, when? I think that it's different for everyone, maybe. And I would think when you mention that, it's true, right? It's the performance level is so high, a performance enhancing substance being used all the time in different realms, whether it's cognitive, physical, etc. But there's not one that enhances your emotions. And if you don't have the emotional bandwidth to handle that high level of performance, right? So here you're performing really well on the top end, but on the bottom end, your emotional well-being is tanked because you're just going 100 miles an hour all the time. That's not sustainable, right? And we even see it with physical performance drugs, right? Physical performance, you're just, up here, you're amazing. But your emotional state, there's depression, there's anxiety, there's all these things coming out because the brain can't handle that. Because we have multiple components to our humanity, not just the physical or not just the cognitive level of performance, but we have this emotional person in here too, our psychological self, which probably is the area that we suffer the most, I would say, right? Whether it's because the other things might be working, but the person inside is kind of like having a difficult time.
You said something that really caught my attention, and nowadays kids are just getting, as you said, overstimulated, and Spencer and I were talking about this, I don't know, about a month ago, and how, especially after COVID, when everybody was stuck in front of a machine and just getting constant stimulation and put people in a loop. And so now that 100 miles an hour, now they want 200 miles an hour, or they're stuck in 100 miles an hour. And you just mentioned they can't sleep. They're just hyper focused, all that kind of stuff. And they're being told that medication is the only answer. And so other than self-medicating, find Adderall from a friend, before turning to pharmaceuticals, what's some strategies to parents, kids can take to calm themselves in the home, help focus, help them sleep? What's some stuff that they can start doing now that if they're listening to us and they don't have a functional neurologist next door? What's some things that they can do as an alternative?
So it's an interesting question when we think about that. And I'm going to try to come from a direction that helps people think through a hierarchy. Like, what could I do? Most people, I think, when they're searching, they start looking for some supplement, right? What supplement can I give them? Not a bad idea. But let's think about the sensory inputs. What can we do? Well, the biggest sensory input is from here down, right? My body is bigger, obviously, than my head, my vestibular. They're powerful, but my body is a big sensory input. So I would say, if I have a child, I would say doing some things that are considered body work, that language, right? Getting a child adjusted affects their whole nervous system dramatically. So getting adjusted, chiropractic adjustments affect the nervous system in such an amazing way. That would be a huge thing that I would say, yeah, you should consider that. In fact, many of the clients that come into us, I'll ask the family, have you ever had your child adjusted? No, never. Never. It's like, for us, it's like second nature. It's like, what? But never. And then I feel some of these kids' necks and it's like, wow. So I will adjust them. That's a small component of what we need to do for them. Then we might do something like a percussion, a vibratory therapy, very slow, because we're trying to calm and lower the over-arousal pattern. So I'm using the body inputs. So massage, adjustment, percussion. Some people even like oriental medicine, acupuncture. I think that could be great for kids. Things that lower the level of arousal. What I also see from parents when they're saying, well, what can we give them is, well, we have them in 3 sports or 2 sports and a musical instrument to keep them busy. I said, that's not what we want to do necessarily, because we're just going. That's not what I want to do. But if I don't keep them busy, I said, I know, but think about calming their system down. Think about that. They're thinking, I want to burn out the energy, right? That's keep them going, burn out the energy. And then but a lot of these kids, they get home, their body's tired, but their mind's still racing. So they still can't sleep. So think about it from a body input, sensory input, adjustments, massage, vibration, a weighted vest. For some kids, I have a little one that I put a weighted vest on him every time he comes in. He's much calmer. If I don't put that weighted vest on, he starts getting all over the place, right? Weighted blankets, very good. Sensory inputs on the wrists. There's all little devices and things that can be used. It's body input to the brain, bottom up. Then we think about top down. What about the eyes and the ears? Is there a sensory input that calms them down, slows them down? Listening to certain brainwave patterns. If you don't even have yet a brain map, we would do things that would calm the brain down. So we would use maybe a device that's called Brain Tap, which is a headset with a visor with lights that flicker at a certain frequency and there's music played. That's just one of many devices, but it's one that we like for people. And that could soothe and calm the brainwave overactivity. So now I've given something for the visual and the auditory and for the body that could all be successful. I could layer in there some supplements What supplements? Well, supplements are kind of a tricky thing. They're not dangerous, but they're tricky because people try and throw so much thing. They throw it all at the wall and see what sticks. We don't like to do that. I like to look at labs with children, young people, teenagers. I like to look at their labs. Often they haven't had lab tests done in a while because they're healthy, so they haven't had things done. So we'll look at things like food sensitivities, or called food allergies in Quest and in LabCorp. Food allergies, which goes undetected and unobserved most of the time. Most of the allergy testing will be done for, as you all know, IgE, for anaphylaxis. And if they don't have that, they're off to the races. No, they're fine. But I'm looking at things that are more subtle, delayed reactions with IgG. And these are in the standard lab tests, but are rarely tested because they're not the gold standard for allergy testing. I agree, they're not the gold standard, but they're the next layer. That is things that you're taking in every single day, right? So if I know, just as an example, that I have a anaphylaxis to bee stings and to peanuts, okay, I know that. I'm not going to be near those. But how do I know I don't have a food sensitivity, a food allergy to dairy and casein and gluten and what are some of the other ones I see? Pineapple, and just on and on. People have different sensitivities. And we remove those for a period of time, and they can perhaps reintroduce them, sometimes not. And you're decreasing inflammation in the body, and inflammation in my body and my gut is going to affect my brain. So when we're looking at metabolics and supplements, you see how I don't just jump in, take this. I say, let's get some labs. Let's look at what's going on, what could be related. Sometimes kids have a high viral load in their body, even though they're healthy. Oh yeah, they get sick a couple of times a year. They always have, sore throats. Maybe they're dealing with a chronic strep issue. That's going to affect their brain. So we look at it from different perspectives. The sensory inputs first, then we look at the metabolic, and now we have a really good complete picture of how to start accurately, based on measurements of that child, coming up with, listen to this, guys, their personal brain formula. That's what we do. Come up with your personal brain formula to help your child with ADHD.
When we grew up, it was like we didn't have the internet. So, you go out and play and you experiment and you don't come in until streetlights come on. And now kids are almost born with earbuds in their ears, listening to music 24/7 and a screen in front of their face. And you see the kids walking around with a phone and earbuds in. So they're constantly getting stimulated from the eyes and the ears constantly.
Yeah.
And as parents, we're like, I remember when I listened to rock and roll for the first time, my dad thought it was the devil music, right? And now our generation is looking at these kids with earbuds and a screen going, dude, get off the screen, go outside.
Yeah.
So what's some science effective strategies to stimulate brain development with these kids growing up with the internet, that's how they socially connect, to destimulate, because you're just constantly stimulate vestibular and eye. What's some strategies that won't cause World War III at a household when you pull that stuff away and the kid freaks and goes manic? What's some strategies for the home?
Well, I'll tell you the strategies, but first you got to give me like an amazing thumbs up for personal brain formula. That's like a great thing. There you go, right?
There you go. Sorry for that. Wasn't overlooked. Sorry.
So, that's the big battle. Actually, yesterday with a new client from out of the country, the family was here, a 14-year-old girl, and they said, our big problem is the iPad, that she's on the iPad all day long. So there's two things I think about, and it's just my personal experience, and then layered upon, the neurology of it. We are in a very highly stimulating or overstimulated environment most of the time with young people, even with adults, right? There's always something that's vying for our attention. Always. I have my phone over here. I haven't seen in this time, but there was one or two messages that came up right when we started. I'm not looking at that, but it's vying for my attention. I have emails over here, right? So we have all these things that are constantly much closer to us, especially kids. We have an ability, because of our age and our frontal development, to override that and say, no, not now, no. They haven't developed that. In fact, they've many times been modeled the other ways. I mean, how many times we go to our granddaughter's softball games And parents are paying attention, but a number of the parents are like on their phone the whole time. So that there's an external component, I guess I'm saying, Terry, which is the environment, the culture, the world. And then there's the internal environment, the frontal lobe that's not fully developed, that can't suppress and repress what you want. So it's just like not enough inhibition. That can be trained, but it's also, you can't train a 12-year-old to have the inhibition of a 25-year-old, to have the inhibition of a 50-year-old. It's not going to happen. But you can help them. So I don't know the answer. I think the answer is family by family, because it's very difficult. Like, which war do I win here? Which battle do I win? Do I win the battle of limiting time? And then, of course, both parents have to be on the same page. And then you have to be consistent with what you're doing. And I mean, we were pretty good at it. But again, we all raised our kids. It was just coming in. And I think we could have done a little bit better with some of the gaming. But you live and learn. You live and learn. So I think it's a personal issue, a personal battle. And people have to kind of set their own boundaries and model also what they want. But you can model all the right things. You can set the boundaries. And there's still a degree of autonomy that people are going to choose for kids when they become teenagers. They're going to choose what they're going to choose. And we really shouldn't beat ourselves up over that. You do what you can, the best you can. Now, if you didn't do the best you could, maybe you could beat yourself up a little bit. But I don't think parents want to stay there, because I really heard this. This was really wonderful. I heard this years ago. Billy Graham. Most people know who Billy Graham is, right? An evangelist, very famous. He's passed away. He had a number of children, but one of his kids, who actually now is kind of taking the lead of that, Franklin Graham, he went very wayward. The lifestyle in the home was modeled a certain way, he was provided for everything, but still made his own decisions, right? So that's what I'm saying is, do the best you can. Learn about boundaries. Learn about how to be consistent, how to discipline and reward, all the things that we know to do. And you have to learn these things when you're a parent, because this is a complex environment electronically for people and kids. And don't beat yourself up over it. You gotta kind of find your line and say, I did what I could do. For
those kids that were in a very developmental side during COVID, during high school and college, when everything was online and their frontal lobe's not developed, are you seeing strategies to help these kids come back so it doesn't, once they hit 25, 26, 27, they're not really behind the eight ball? Is there some strategies that won't create a huge war at home, but also allow the kid to find a way out?
Well, I mean, I have to just speak from what is my thought about that,
yeah.
Right? Because there's not any clear data. But if I want to get so a lot of the people that struggled, young people during that time, was due to isolation. Electronics can continue to, I was looking for my headphones here. I'm sorry I didn't have them today, but I've noticed this trend among 10 to 12-year-olds recently, wearing headphones all day long, not earbuds, headphones all day long. I noticed this with my granddaughter. And I said, ooh, and then I saw another one. And then I had another one. I'm like, I think this is a thing, that they are wearing headphones, not earbuds, but the headphones. And it kind of gives you it separates me from the world. If I don't want to talk, I don't have to talk. I'm listening, right? And I'm in my own world. So this is further isolating human interaction, human navigation. Oh, I said the wrong thing. Oh, I better say it differently next time, right? We're learning by human to human relationships. And all these things are kind of pushing back another barrier for them, which I don't think is great. How do we approach that? I don't know. But let me say this one thing, last piece. What can we do? Exercise. I think exercise is one of the best things, to be honest with you, because you're going to engage your frontal lobe in a team sport, in an individual sport, because you have to focus, you have to concentrate, you have to plan, you have to execute. Exercise has some of the best research compared to any other strategies for activating the brain and strengthening brain networks. So I would say, get these kids into some kind of sport where at least during the sport, they have to put their phone down. I think that there's so many benefits from some kind of individual or team sport that you're going to reap a lot more, bringing them back into functioning with people. right? At least in a couple hour segment of practice and games, than they would have. If not, they're going to be on their phone with their things isolated. Does that make sense? Right?
Mm-hmm.
I think we all agree with that.
I think it is absolutely criminal that they did away with physical education in schools. You have young males, having testosterone surges as they grow up, and they want to be active, they want to be aggressive, they want to get out there during their intermission from class, and now they're not allowed to. They come in, they're wired up, or they don't come in, they don't get any break, and they have to sit in class listening or reading. And the teacher goes, listen, quit hitting Johnny, or quit, running around, quit doing that. We're going to send you to the principal's office. And then they end up, going to the doctor, and the doctor prescribe, it's such a negative cycle. It's vicious,
Yeah.
but
I think that's pretty well characterized. Yeah.
Exercise to get that energy out there, especially in young males that are maturing, females as well. But
get the energy out and to really hit the frontal lobe and some of the other brain areas. When you start getting those brain areas working, so it's the energy dispersion, right? It's also the brain activation too. So then that goes to, should I have them in a sport and a musical instrument? And then, no, that's too much. That's overload. No, but I want to burn out the energy. Don't think only energy, but yes, we want to have, because we need that breakdown of ATP, right? We need that. So now ADP builds up in the frontal lobe, helps me sleep. So we need it, but we can go too far. I'm sure at our ages, we've all trained on a day or many days where you overtrain and you're like, man, I'm having trouble sleeping. My brain is just, I'm overtired. We don't want that. But we do want that brain activation from exercise. So I say 100% exercise.
Anyone listening that's a parent, I'm also kind of concerned about the thought that there may be some other factors involved with why a child or an adult or a teenager would wear headphones as often as they do. There's 2 points, other than wanting to shut out the world, but it's become a fashion statement or a fad. That's one, to look cool and wear headphones. Secondly, you have a sensory adaptation to the excellent acoustics that occur in headsets like that. So I wonder, before the parent says, hey, you need to, get that out and start being interactive, realize that kid is probably addicted to the look and the sound.
Yeah, I agree with that. That's a very good observation.
With that said, what about adults? They expanded the scope of prescribing Adderall to adults. They said they allowed the possibility of, hey, maybe at 40 years old you have ADHD, and that may be true to some degree. But adults have fully embraced the idea of feeling scattered, overwhelmed, impulsive, and then going to get a prescription of Adderall.
It's just the culture we live in, man. It's just the culture we live in. It's difficult. It's challenging externally. And it's what people turn to perform and to function. I saw something yesterday regarding moms and taking care of kids, which is stressful these days, maybe more than in the past. I don't know. Obviously, I'm not a mother, but it's a lot of demands on them with multiple children. And it was cannabis for moms, and that they get together, these moms, a couple nights a week, and they enjoy that, and then they play games, and it gives them a break. But anything can go too far, right? Anything can go too far. If it's drinking, if it's cannabis, if it's Adderall, if it's performance, it's anything can go too far. The thing is, I think most people they don't know where the too far is, because they think they're functioning pretty well. So we always come back to not always the external things. Come back to let's do an evaluation of the brain. Let's do an analysis of the brain to see how well your brain hardware is functioning, because you're performing well. You're a mom with kids. You're a physician. You're a college athlete. You're performing well. You're doing well. But let's see what's going on in your brain so we can know. So we start. That kind of is not as something's wrong with me, and then we go from there. Like, hey, we can maybe improve this for you. Of course, there are many conditions that people come in with conditions, but we want to still talk to them in a way that is building them up, that is providing them agency, that they have control over their health, that they have a direction, and they can improve things. And that takes a little detective work to know how to have empathy with patients. I know Dr. Barron does, Dr. Terry. I mean, you and I haven't spent enough time, but I would imagine if you two are close, it's because you are that whole complete kind of person as well. Empathy, physical training, clinical excellence. So you have that whole thing. That's such an important part of caring. So a lot of the things we're talking about, I don't have an answer like this is the general. It's like I have to see this family or that person and that adult and that teenager to know and talk with them. How do I need to communicate? What's going to help build them up and move them forward?
Dr. Mike, you got any action steps that our listeners and viewers can take, especially adults, that would make an impact today, like something they could start with right away? Now, I know you mentioned exercise. Any other suggestions, or if you would like to elaborate on exercise and what type of exercise?
I have a beautiful chart on my wall. Actually, it's a big plaque, and it shows, it's from a scientific article on way different exercises affect different regions of the brain. And it's just fantastic because none of us here who have been exercising for years do only bench press. None of us. So we do, weight resistance exercises and bands, and maybe we've used ropes, and we've done plyometrics in the past, and we've done dynamic stretching, and we've done yoga, aerobics, and HIIT workouts. So we've done this variety. So the variety is usually the best. You have a variety of things that will help the brain work in many different ways. So variety of exercises are best. And you can do some Google searches on that. Exercises effects on brain regions. And you'll see some of these charts, which are beautiful pictures. They're easy to understand. Other things for people to recommend, we did talk about the sensory inputs for attention. And so I'll mention these one things. I'll mention Brain Tap. I think that's probably, and I have no disclosures with them. I do not receive any compensation, but we use this headset. And there are other types, but what it is audio, visual entrainment. So it has many different programs, but we use the ones with certain brain frequencies. So alpha, delta, theta, beta, and gamma. And a person will wear the headset. Sometimes they'll put the visor down, sometimes not. There's lights that flicker in there. They're the same frequency of the music. And there's alpha frequencies or delta or beta embedded in the music. So you're just listening to a short period of time of music. But what that can do to someone's brain, in fact, one of the developers of it, who's the owner of the company as well, he was a meditator, a person who meditated for years prior to developing that. And he said, using that system has helped me get into a meditative state faster than all the years of work that I did before. That's something for someone who's been meditating for over 30 years before they tried it. So I think that is a excellent piece of low-cost technology that you can operate off your phone, like many of these things, that can be used among different people of the family. And it's kind of self-guided for the most part and can alter brainwave function for the better, for sleep, stress reduction, attention improvement, arousal in the morning if you're very sluggish. There's many different programs on there. So I think that would be probably a low-cost piece of technology that's non-invasive that everyone can use. And I think it's an excellent tool.
To elaborate on that, and I think that not only are you so accurate in your description of this, but there are some studies that a certain type of classical music with no words, obviously classical music, and I might be botching this up, but Mozart and D minor, and it actually improves your ability to study, improves memory and spatial temporal reasoning. And that has been shown clinically. It's really, I forgot about that. I haven't thought about that in years. That's a great
100%
idea.
accurate, great quote. I think you actually mentioned the accurate components to that. Mm-hmm. And yeah, all of this music has no voices to it. No. But what you see in the classical music, and you see in many other types of music that are stringed instruments and things, instrumentals, are a coherence pattern, right? A coherence pattern. And I might just throw this out, not that I have evidence, but some music that might be like when we were younger, might be a little more wild over the top, may have a not a coherence pattern that we would cause the brain to oscillate at a more steady state. It might oscillate really high and really low. I can think of a few artists that I used to listen to, but we won't mention them. But yes, classical, harmonics, and I'm not an expert in this. My son is in musicality and instruments as a musician, but there are coherence patterns that are more beneficial to the brain found in classical music. That's 100% accurate.
What's your thoughts on binary beats and synovial rhythms?
Very similar to what's played through the headset. So you can actually, let's say you didn't buy the headset, you didn't want to do that. You can get binaural beats apps on the phone. You can listen to those. And then there's great benefits.
Okay.
You would still be using those. A person would still be using them saying, I'm not sure which one I need, but let me try this. And there's some explanations, right? I'm having trouble with sleep. I'm having this. So it still wouldn't limit me from saying at some point this year, I want to get a brain map. So I really know what my brain waves are doing so I can set the right binaural beats more specifically, right? So we're always like that, right? I wouldn't want to have plates that I work out within my gym with no numbers on them. I mean, I know by the sizes after so many years, but what if they were all the same size? I don't even know the weights. Wait, I'm not sure. So we want a little more specificity. But if you don't have that, you can use those apps and you can do gentle experimentation with yourself in alpha brain waves and maybe theta to relax yourself. And I'm sure you'd be very safe in that. And those are very good to do.
I've seen when you go to certain music apps that you'll have synovial rhythms and it'll give you awakening, depression, this and that. And you can listen to those like in the morning or in the evening to sleep. And then you have binary beats that will break it down as well. Is that something that, because most people have music on their phone, is that something you would recommend in the morning or at night to help sleep, to listen to,
Sure.
break your day? Okay.
Absolutely. I think it's worth a try because it's low cost. It's very efficient. It's on their phone. And I think the safety level is pretty high. I think it's worth trying for sure.
Perfect.
Karen has the speakers that conduct the binaural beats before going to sleep to calm things down. And they're pretty cool. Yeah. They're almost mesmerizing to some degree.
I like it. Yeah, very good.
Dr. Mike, you are fantastic. We're going to go into our rapid fire questions. And I know you're always ready, willing, and able. Are you ready for number one?
Go.
Dr. Bagnell, you've been on countless shows and had deep conversations about the brain and human potential. But what's one question you wish someone had asked you, but never has? And now that we're here asking, what would be your answer?
What's one question they would ask me? I wish they would ask me. Well, I think the first thing that comes to mind, I guess that's what I should say, is that, the discussion is often in healthcare about the body, many times about the brain, of course, about the brain, but very rarely about the spirit. Very rarely. And why would that be something to consider? Because if we're a three-part person, and I believe we are a three-part person, meaning body, right? Contact the physical environment, soul, which comprises the mind, the brain, the mind, the emotions, and the will, all of our brain function, basically. That's the psychological self. It's who I am, my soul. But that every human being has a third part, which is the spirit. And I think probably the majority of 8 billion people would say, yeah, we probably have this thing called the spirit. But rarely does that ever come up when it comes to anything regarding health. And I remember hearing a chaplain many years ago at one of the hospitals who works with all different faith physicians would say, I attempt to help them understand that the patients are three parts. Because if you just treat the body, and we've experienced that with other physicians perhaps, where it's very cold, very cut and dry, but then the person's suffering because you dropped a bomb on their life, right? And so their soul is like really suffering. But they also have this component called the spirit. So he would help them, regardless of their faith, to have a consideration for that so that they might be more aware. And in the awareness, they might be able to serve people better. And so understanding a little bit about the spirit would always be a good question. Let's open that door and go through it a little bit, because I think it's a fascinating place that doesn't get enough attention.
Question number 2. Let's look back at 10-year-old Michael Bagnell. If you could send one letter, just one single paragraph back in time, what would it say?
Don't smoke those 2 packs of menthols in one day. That was a big mistake. big mistake. Don't do it. But the reality was I never smoked another cigarette since then.
You actually did that?
Yeah, I was 10 years old with this kid who was maybe 13, and he had these packs, and we smoked them one after the other. I was so sick. Like, that's never happening. So maybe it was a blessing in disguise.
Yeah.
And I would say, hey, man, don't do that. You don't need that.
That's true immersion.
Yes.
Oh, that's a great one. In your journey of understanding the human brain, behavior, personal growth, and all that, what's the biggest belief you once held as truth, but later realized, whew, I was completely wrong?
Well, that would definitely be related to the brain. One of the answers would go back to the spirit, but we left that one already. So the other one would be about the brain is that, the way the brain really functions, we're just tapping or scratching the surface on that. And in that, every year to 2 years, something happens in neuroscience that I realize, oh, that's not really why that works. It works actually this way based on the newest data that we have. One of those things that was surprising was in chiropractic. That was probably one of the bigger ones in the professional aspect of my life, was that, all these areas of, we'll call misalignment in the spine, that many of them have the high probability of being caused by neurologic compensation.
Yes.
And that was like, what? Because I would think that these are the primary thing. Then when you really open up that window and look into the neurology, you go, oh, the recurrent aspect of that. Now, of course, there's some from injuries and things, which we realize, right? But it's not possible to physically move one bone on another volitionally. Like, I can't do that. It's more reflexive in its neurology. So these things happen by automatic, by movement. And so thinking about that caused me to really reconsider the significance and importance of why people should be getting adjusted, and two, why their brain needs to be evaluated in relation so you get even a better response in the adjustment and then their brain function.
And for the listeners and viewers, again, to put that into some very, very practical perspective, you can crack someone's neck all day long because they feel like they're doing this, and yet you didn't identify the fact that they have some hearing loss in one of the ears and they're always doing this motion. And until you put a hearing aid in, then you can listen with a certain posture.
Perfect example.
I think that's fantastic. I'm glad we brought that up. Now, let me ask you, we've been friends for so long, and you've been through, a few iterations of a healthcare provider. As you are today, if you look back, what was that moment that you may have gone down this life path that could have changed everything versus where you're at now, based on like one decision that you might have made?
In the professional career?
Or in life in general?
Well, I mean, it keeps coming back to the same thing. My life changed dramatically when I discovered my faith, dramatically. And that took in fact, my mom asked me some years later about a situation. When I was in college, I had gotten into some things with the law as a college kid. Not uncommon. That happened to a friend of mine years later. My mom said, "Didn't you really change after that?" And I said, "No. I cleaned up my act, but I didn't really change." When I really had an internal transformation that I was like, okay, this is real, was when my faith hit the ground running. That's all of a sudden things shifted. And people even noticed, what happened to you? Something's different. And it wasn't because I was saying this or doing that or telling them this or telling them. They were saying something is different with you. And where I noticed that was when I went to like my 15 or 20 year high school reunion, and all these people were like, "Who are you?" And it wasn't because I was a chiropractor, and it wasn't because I was preaching this or that. There was something emanating from me, which I was thankful for, that was different. So that was in that aspect. That changed me. And then when I graduated chiropractic, I started into this neurology course for doctors of chiropractic. And that caused me to be like, I got the bug. I was like, oh, there's something here that I really love. I did have to put it on the back burner for many years with a family, and I had to just kind of do what I needed to do. But I always was interested, and I would read different things on my own. And then eventually, as you know, the rest of the story is I dove fully into that, the next iteration of who I wanted to be in practice, as many of us have. And now we're at a level where actually even something happened last week that I went to experience some technology that is really on the cutting edge of changing, I believe, what's still possible in improvement of brain function, which we'll have to talk about another time.
That'll be number 4. That'll be the fourth. That'll be the 4th interview.
That'll have to be like in the fall. So,
Okay.
But I'll let you know as things progress. But anyway, I experienced, because technology with knowledge can really give you great breakthroughs. As you know, you need the knowledge, but sometimes the technology can give you a great breakthrough in something.
And you're a gadget guy. You love that stuff.
I do. I find them fascinating. I'm not so savvy technologically, but when something has the ability, Dr. Barron, you and I know, we cannot see the accuracy of saccades. You can't see it. It's so fast. A saccade is a fast eye movement. You can't see that the way a measurement device can show you. And then you're like, wow. And then you're not able to see, after adjustment, the change unless you had that same measurement. So there's value in it. And of course, you can go too far with anything. I don't want to be whatever that show was with a guy with all the tools. But I do like having things that give me greater insight into the way the brain works. So if I can, I will.
I was just talking about you the other day to a patient where you have that monitor that tracks your pupils, and there's a passage that comes up on the screen that you can figure out how and why someone has reading comprehensions below normal, because they're all over the place and they're not, and it tracks their eyes. Yeah. And then it puts it on not a grid, but on the paper that they're reading, and you see how all over the place they are.
Right? That's a phenomenal thing when someone has a reading issue. So technology has its place. It has its place, and it doesn't take out the art of being a proper physician. But together, proper physician with the knowledge and the training, and with a piece of technology that gives you greater insight that's non-invasive. Wow! Now we have a beautiful marriage.
I agree, and I think it is extremely important to mention that gadgets will complement a good physical exam. That I believe the art of the physical exam is lost in the medical profession, even some chiropractors, and that you go to your orthopedic and he says something about your knee. You say something about your knee. He goes, well, let's do an MRI. There's technology that he's using in place of a good physical exam for the knee. So I think it is extremely important, because you have a fine balance between the ability to examine physically and the communication skills, and then order the appropriate tests rather than just.
I think that's right. I think I heard it said like this, that your diagnostic tests, your technology, should confirm what you're finding on your physical exam.
Nice.
I love these rapid fire questions. We get Lori Barron talking.
There is no rapidity to these questions.
That time, though. It's that time.
Yes. And we are on time. One last question. Fast forward many years from now, Mike. Your time on this planet is done. At your memorial, someone steps up to speak about the impact you made on their life. What do you hope they say?
Good question. Well, I think you want them to have an experience with you. I think I'll say it this way. My wife and I went to a funeral of one of my patients, several weeks ago. And this is what I would not prefer. Now, this guy was a very wonderful guy, very sweet. But every person's statement, which was very heartfelt and touching, was about how much of a life of the party he was. He was the life of the party. It was the party. It was the party and the party and the living and party. That's not the epitaph that I want to leave, that I was the life of the party, that I was some silly joke-telling guy. I'd want it to be that whatever I said or did actually was a support to someone, was a contribution to them. I don't want to be known as that. So I want to not be known by something silly or foolish. In fact, that's why I tell one of my stepbrother, I said, I don't want you talking at my epitaph, at my service, because you know too many things and you too silly. You're going to say something like off the chart. So we're not going to go there. We want to leave something that has helped someone, right? Whether it's our own children, whether it's a colleague. I mean, I would hope that it would be something they say, he was quiet, but he contributed to my life. Amen. That's good enough.
Right on. Dr. Michael Bagnell, I always appreciate these programs and the interaction on an official level and even on a personal level. We have these wonderful talks. So thank you so much. And I can't wait for interview number 4.
Or Pete.
Thank you, Mike. You've always been a blessing, and you are a very powerful yet quiet and impactful man. So thank you for all that you bring to the table.
You're a good man. Appreciate y'all.
Thank you for listening to today's episode of the Crackin Backs Podcast. We hope you enjoyed it. Make sure you follow us on Instagram at Crackin Backs Podcast. Catch new episodes every Monday. See you next time.